Okay, knock, knock, knock. Hello, my name is Erica. I'm your student nurse today. The doctor has ordered for me to insert a straight catheter. Is that okay? Okay, do you have any questions or concerns? Okay, are you allergic to betadine, tape, or latex? No, okay. Can you verify your name and date of birth for me? Okay, and then I'm going to check the wristband to verify patients. I'm going to perform hand hygienes, pull the curtain for privacy. I would put the patient in dorsal recumbent or the lithotomy position. I would put on some regular gloves and I would perform pericare to the patient. And then I would remove those gloves and I will begin to do the sterile for my insertion. Okay, so I would just take this out, toss that on the floor. Okay, and then I would slowly smooth that each corner. Do not break the 1-inch border. And towards me, pull this one out as well. Okay. Don't need that. Gloves over here. Okay. Don't need this as well. We're just gonna toss that out. And then I'll position this over, kind of over here, and then I'm gonna come over here and I'm gonna don my gloves. Okay, also be careful with opening. Do not break the 1-inch border. Just turn it. Okay, and then I'm gonna don my dominant hand first. So just touch the rim of it. Okay, then put my glove on. Okay, and then I will come and I will do the other side, just slightly lifting this side. Okay, and then I will insert my hand. And my hands like to get stuck. Okay, and they're stuck. Okay, be sure not to touch the bottom, but I'm gonna just come up here and fix my gloves and kind of just wiggle that on there. Okay, so this is still sterile. Get rid of that. And then I'm gonna come back here. Okay, now that I have on my sterile gloves, this is still sterile. I'm gonna just slide it down some so I can have enough room. This is my cup. Just gonna shake this a little bit. Be sure not to break sterile full. Hands remain above the waist. Shiny side up under the patient. Okay. Do not break that border. Okay. Just position my box. Get everything ready. I'm gonna open up my swabs. I'm gonna open up my lube. Go ahead and squirt some right there. Okay, and then I'm going to go ahead and, well, squirt some in the box, sorry. And then just leave my swabs right there. Okay, I don't need that. Okay, and then I'm gonna go ahead and hook up my syringe. Where's the thingy? Okay, it's upside down, but I'm gonna go ahead and connect my syringe. Okay, lay that like that. I'm gonna break sterile fill, and then I'm just gonna remove this paper. I'm gonna say that's the trash. Gonna just sit it right there in the lube. Okay, now that everything is assembled, I'm gonna bring my box closer to the patient. You're gonna feel a little pressure, so it kind of helps if you bear down. Okay, I'm going to come up so you can open. Once I put this hand on the patient, I cannot remove it because it won't be sterile anymore. So I'm gonna go right here and I'm gonna open up the labia, and I'm gonna begin cleaning my patient. We're gonna go up, down, and we're gonna come around, trash it. We're gonna do the same for the other side, up, furthest away. Also, we're gonna go around, trash it. Have one more. And then we're gonna go straight down the middle, and we're going to come around and trash it, okay? I'm gonna go ahead and do the lube it up, okay? And then I'm gonna go ahead and insert. I'm gonna insert until I see urine. Once I see urine, I'm gonna go 1 to 2 inches in deeper, okay? And then I'm going ahead and inflate my balloon. And I'm gonna do 10 cc. I'm gonna go ahead and inflate. Inflate. Okay. Okay. Then I'm gonna go ahead and remove my syringe, and I'm gonna go ahead and tug. That's good. Make sure it don't come out. Once it's secure, clamp it right here. And then I'm going to, with some tape the connector to the inner thigh, the middle thigh right here. And then I'm gonna hang my bag on the lowest part of the bed. Okay, you ain't got it. And then I'm hanging on the lowest part of the bed. Okay. And then once I do that, I would just then remove everything, and then I would clean up my mess. I would take off and apply new gloves. And then if need be, I would wipe down the patient if need be. Okay. So when it comes to removing the catheter, I would just come in and I would deflate my bag. I just broke sterile fill, but I'm now taking it out. But I would deflate my, would drain my bag, and then I would remove the tape from the inner thigh, and then I would take my fluid back out. Yep, so that's all of it. And I remove the syringe, and then I'll just gently pull it out. And then everything that I've used would then go in the trash. Of course, I have on clean gloves, and I will once again wipe down my patient. And how did you handle it? I would say the patient handled it well. And then I would make sure the patient is comfortable, and then I would go and document. So that is inserting and removal of